before, but we didn't have to open the chest second time, and these are all the successful diagrams that we do. Okay, let me move down. Now this is another one, another chronic type B dissection which has a double lumen. So I put a stent in and I put some coils in top and bottom so that the double lumen is transferred, become a single lumen. So I can show you, these are the very complex stuff that we do all the time. Now, apart from that, I did mention that sometimes you have an occlusion of the aorta due to smoking. And this is what we did, a kissing by iliac stent to open up. This is Dr. Tang here. This is myself. And these are my two junior consultants. I went back to a restructural hospital to teach them how to do. And Dr. Tang was instrumental in teaching them. Okay, let's move on. Now, I want to talk a little bit about lymph node biopsy. When you have a lump in the neck, right? A lot of people didn't know the significance. Now, most of the time, if you have a lump in the neck, it's benign. You know, sometimes you can have cancer, but the benign stuff are you can get a sebaceous cyst, you can get an inclusion cyst, you can get an epidermoid cyst, and sometimes even in thyroid cyst, and you could even get a multinode goiter. Sometimes it's an infected lymph node. But you have to be aware when you get a lump in the neck, it could also be cancerous. Why? Because in the neck, apart from all the benign lumps I just spoke to you about, the neck has a lot of lymph nodes, okay? And this lymph nodes normally is a reaction. When you have an enlarged lymph node, it's a reaction of some pathology process going on. And it can be due to a thyroid gland problem. You can have thyroid cancer and it moves to the nodes. You can have an infection in the oral cavity. So I always example, you can even have dental decay and one of these lymph nodes can be swollen. But the other side of the things that you need to worry is that two types of cancer, which is quite popular in Asia. One is nasopharyngeal cancer, we short-termly call NPC. The other one is lymphoma. Lymphoma has two types, and there's non-Hodgkin and Hodgkin lymphomas. And not only the neck lumps are swollen, there are other lumps in the armpits, the groin, but the most accurate diagnosis is biopsy from the neck lump. And in order to look at whether you have any disease, we normally do blood tests and blood film. The blood film will tell you whether you have lymphoma or not. You look at things like CRP and ESR to look for infection. You do thyroid screen and thyroid antibodies to check to make sure this is not, coming from the thyroid gland. Now, I recently saw a patient which is very healthy, and he's got a large neck lump, and he came to see me. And I examined him and did an immediate CT scan. And he doesn't smoke. There's no history of any unwellness. And then immediately I did a lymph node biopsy, which is huge. The lymph node took it out of the neck. And then the biopsy came back as nasopharyngeal cancer. And, if you do a PET scan straight away, I have to refer this onto an oncologist. Remember, lymph node biopsy is very simple technically. But what the treatment of disease afterwards is very complex and always involve a multidisciplinary team with your oncologist. I would like to pass the time on to Dr. Tang, who will continue to present, and we will take questions after all these. Thank you very much, everyone.
Okay, thank you. Thank you, Dr. Wong, for the great presentation. Now, selanjutnya saya akan mengundang Dr. Tang. Halo, Dr. Tang, are you with us?
Yes, I am. A very good afternoon from Singapore. Hope you're well.
Okay. Thank you for being here. This time we talk about varicose vein. Is it right?
That's correct. Not as glamorous as aortic disease, but all the more important. It's much more common, and it's a very treatable condition that will get your patients much better very quickly and improve their quality of life. You may not save their life, you give good quality of life. So thank you very much for Livinwell for having us here today. It's been a delight to collaborate and hope we can move forward with a good collaboration and help your patients.
Okay. I will share the screen for your presentation, doctor, and you will explain slide by slide, and I will translate it to Bahasa.
Thank you.
Okay.
I don't see a shared screen.
Now, can you see the share screen, doctor?
No, it's black. It's dark.
Wait a minute.
Julian, can you see the screen?
Yes, I can.
Yes,
I'll come
doctor,
to
you
your
can see
room.
your
I don't
screen.
see anything on my screen. Just hold on.
Okay.
You want to present on mine? You don't present on mine. Let's use mine.
Yeah, so I'm using Dr. Wong's screen. Okay.
Okay.
So let me start. So I've been asked to give a talk on varicose veins and how they can be treated. So next slide. So what is the definition of varicose veins? So these are abnormal dilated veins on the lower limbs, which are more than 3 millimeters in maximum diameter. Now, why is that important? It's important to note, I get a lot of referrals from patients who say they've got dilated veins on their arms. There is no such things as varicose veins on the arms, and they should not be treated because you need them. And if you treat those, you can cause a lot of cosmetic problems. So only treat dilated veins on the lower legs. Next slide. So these are examples of varicose veins. So you get these lumps on the inside of the thigh and inside of the calf, and even at the back of the calf. And in fact, all of these veins, you can actually appear anywhere. If you see these are abnormal. And if they have symptoms that go with this, which I'll go on to show you, they should be treated because the disease is progressive. It's almost like a degenerative disease, whereby, like in the knee, you get degeneration of the knee cartilage. It's the same in the veins. Next slide. So this is another example of a patient with varicose veins. These are dilated veins on the surface of the leg. And these are almost always branches of a faulty vein that just lies under the skin on the inside of the thigh and calf and at the back of the calf. Next slide. Now, these are the smaller veins. These are called reticular veins, and they're just part and parcel of the same disease process. The fact that you're seeing these veins on the surface of the leg, they may not look huge, but they are telling you one thing. Just like how you have high blood pressure in the arteries in your body, it's just telling you that you've got high pressure within the veins of your legs, and that possibly you may have an underlying problem with the valves that basically control the blood that goes back from your foot back up to your heart. Next slide. Now, these ones are even more popular with patients. They love coming with these types of veins, and it becomes a cosmetic issue. So I've had quite a number of Indonesian patients come across, especially young females, who've come across asking these to be injected. They can easily be injected, but importantly, it's important to treat the underlying problem, the higher pressure within the main venous system, before you do this. Because otherwise, if you don't treat the underlying cause, these veins will just pop back up again and recur. Next slide. This is the kind of spectrum of legs that I used to treat when I was at Singapore General Hospital. These big, swollen, fat legs with skin changes. We tend not to get this as much in private practice in Singapore. They come much earlier. But if you see any of these patients with skin discoloration, brown pigmentation, wounds that are taking a long time to heal, you think there may be eczema, and you've been speaking to a dermatologist who have not really given you much help in terms of treating it, and it keeps coming back, think of underlying vein problems. Next slide. So how common is it? Well, it will affect 40% of the population, and by the age of 70, it will affect at least 70% of that patient population. People think it affects females more than males. Actually, that's completely wrong. It affects equally both men and women as they get older. And because of people are living longer, the prevalence and incidence is increasing, especially with age. People with diabetes actually seem to have these common symptoms as well. And actually the coexistence of venous problems in diabetics is on the increase. I say about diabetes because diabetes is a very common problem and it's increasingly prevalent in all our Asian societies. There is normally a hereditary, which means it runs in the family with varicose veins, typically on the maternal side or the female side. A obese, sedentary lifestyle is also associated with developing these varicose veins. Typically, these patients are often sitting down for long periods at the desk. So those high-flying bankers who sit in front of the computer, those people who sit behind a till, checking out the shopping, these are all patients highly at risk of developing vein problems. People say that pregnancy is associated with developing varicose veins. Well, actually, that's not completely true because people who are pregnant will have higher pressure inside their abdomen, causing back pressure on the veins in the legs. But after pregnancy, those should return to normal. But the more pregnancies you have, the change in the hormonal status of the body predisposes you to developing weaker veins in the legs. Next slide. So what are the symptoms? These are the symptoms you should look out for in your patients. And you should think immediately that could there be a vein issue that is not being seen. So aching in the legs, especially towards the end of the day, people can often complain of heaviness, tiredness, restless legs at night, cramps in their calves, throbbing sensation, burning, as if someone's stabbing them, swelling. Swelling is a very common symptom or sign, and it can be associated with lots of other medical problems like heart failure, kidney failure, or liver failure. However, if you get swelling on one side, that's more like a mechanical problem, and you should look for an underlying vein issue. Itchiness, brown pigmentation, don't assume it's a suntan. Assume first that it may well be stasis of the blood in the leg caused by valvular reflux or chronic venous insufficiency. Next slide. So these are the risks as well of developing it, as we discussed earlier, but I wanted to highlight patients who have had previous clots in their legs, any kind of inflammation of the veins in their legs, and also a previous surgery on their legs, a higher disposition of developing these problems. Next slide. So remember one thing. If anything you take away from this talk, varicose veins is not just a cosmetic problem. And unfortunately, a lot of GPs, a lot of general practitioners think this may well just be a cosmetic issue and let it lie. Problem with varicose veins is that it is not just a cosmetic issue. It is a medical condition, and it should be treated as a medical condition because it is progressive. It causes skin damage on the legs and can cause a lot of pain. And therefore, one thing to remember, patients with insurance are covered under medical grounds to treat varicose veins. If it's for a cosmetic appearance, that's different. But if it's for medical grounds, such as symptom control and improvement of quality of life, it is covered. Next slide. So these are the indications to treat on a medical grounds. If their legs are feeling very tired, painful, affecting their quality of life, affecting their daily lifestyle, it's the definite go ahead. Any skin changes are precursors of developing wounds on the legs, and therefore difficult to treat, should be dealt with. Any inflammation on the veins, these are likely to happen again if you don't treat the underlying cause. Any infections of the skin of the legs should make you realize that there may be an underlying venous component. Bleeding from varicose veins can be quite torrential and quite harassing to the patient and their families, because they really do hose out. You should be treating the veins immediately. And obviously, if you get an ulcer on the leg, you should treat the underlying vein problem as well as wrapping the leg to heal the ulcer. Next slide. So what are we looking for? We do an ultrasound. So whenever patients come, we obviously take a history and do an examination, but you also need to do a special ultrasound called a CVI duplex scan. CVI stands for chronic venous insufficiency. And what you want to do with that scan is you want to map out where exactly the problem vein starts to where it basically finishes, the severity, the extent, and map out the anatomy. By doing that, you see the severity of the problem, and you can, if the patient does not want surgery immediately, you can track it using a serial ultrasound. The other important thing about an ultrasound is that it will give you clues about what is the best devices to use to treat these veins. And everything is done keyhole now, which I'll show you. The other thing is to look at the deep system. The deep system that's responsible for things like deep vein thrombosis. Those are the things. If that is clear, you're likely to get a good benefit if you actually treat the underlying veins under the surface of the skin. Next slide. So not every patient with varicose requires surgery. So those who are completely asymptomatic, leave alone. These are the options. Most patients will try compression stockings. And because of the temperate climate in this part of the world, most of them will not like it. By the end of week 1, they'll throw those away, even if they're the best fitted stockings. You can have the only medication that works for varicose veins is something called Daflon, which is like concentrated vitamin C or flavonoids. It's like 100 orange peels basically stoked into one tablet. And that improves the tone in the veins wall and therefore allows the veins to compress better and basically clear. Next. So basically, surgery used to be the main type of surgery, to be the main source of treatment. We no longer do open surgery. Everything is done by keyhole. And there are different types of keyhole surgery depending on the anatomy of the vein. And also we tailor it specific to the patient's needs. And these are the big categories: laser, radio frequency, and we even got microwave. We're microwaving veins now because they seem to reduce the trauma to the patient, and obviously foam sclerotherapy. Next slide. Compression stockings, what do? Well, they need to be fitted properly, and they push the blood out of the foot back into towards the heart. And the benefit only lies when you actually put it on and wearing it. If you take it off, the effect goes. But it's never been proven to basically prevent progression of the problem. In terms of compliance, as I said, major problem in this country, even post-operatively. Only about a quarter of patients will wear them after surgery. Next slide. So you can get all types of lengths. The way I see compression is basically the least amount you're wearing, the better. So the majority of my patients get below knee stockings, and it's a closed toe to make sure they don't kind of slip in their shoe. Next slide. So this is what we used to do. And this was about 20 years ago when I was training and back in Cambridge in the UK. We used to do open surgery, disconnect it. This is no longer the gold standard and should not be advised to give to patients as a first line because recurrence is much more common. Also, the risk of nerve injury is much common. And obviously, the downtime will be much less, will be much more. Issue here is you only reserve open surgery for those with really big veins that you cannot do with keyhole surgery. And that is few and far between. I've only done about 5 open surgeries in the last 1,000 veins I've done in the past 7 or 8 years. Next slide. And that's why it causes a lot of pain, a lot of bruising, and potential nerve damage. And recurrence is much higher. Next slide. So these are the categories of how we treat. You would have heard of laser, radiofrequency, steam. We don't steam veins anymore because the devices are not available in Asia. And now the new kid on the block is called microwave. And at the Vascular and Endovascular Clinic, we give you the opportunity of actually giving your patients microwave ablation. And we've been teaching a lot of people coming to our center, especially from Indonesia, from Surabaya, and from Jakarta. And I've also taught at the national meetings for vascular surgery in Indonesia how to use this device. And the effects seem much more favorable compared to laser, reduces a less pain post-operatively, less bruising, and return back to normality quicker. We also got the non-thermal techniques, the ones that doesn't use any heat, and glue, and something called Clarivane or Mocha seems to be the new kind of delights on the dish, basically, for varicose vein treatment. Next slide. So radiofrequency ablation is probably the one that most people use at the moment. It has the longest follow-up in terms of data. The 15-year follow-up from this seminal paper from Mark Whiteley in the UK showed very good clinical success rate, and reinterventions are very low. So a lot of people use this. Next slide. So this is how we do it. We basically get access into the vein, just where the vein problem starts. It's all keyhole, 2 to 3 millimeter cut onto the surface of the skin under ultrasound guidance. We pass the catheter up to where we need to block it, and we block it off, and everything comes out at the end. Next slide. And that's what we do. We pass the catheter inside the vein, so it heats the vein from the inside, and basically it comes out at the end. Next slide. And that's what we do. We basically burn the vein from the inside in different segments, and around that vein we put local anesthetic and cooling liquid like saline to prevent any damage to surrounding structures. Next slide. And this is what you can achieve with radiofrequency. This is one of my older patients from about 5 years ago. Basically, the pre-imaging is on the left, and the post is about 3 months down the line. You can see they get a very good cosmetic result, and they're basically improvement in quality of life. And this patient has yet to get a recurrence. Next slide. This is another example, very big veins. You can see how you can treat these very effectively with very good cosmesis, with minimal scarring, with keyhole surgery. Next slide. So this is the post-procedural care. Basically, the patient's symptoms go almost immediately. They wear compression stockings for about 48 hours, and then I actually give them the choice. Some people say you should wear it for 6 weeks, but in our temperate climate in Asia, I think that's completely unreasonable. And I tell them to do what you feel like, and most of them do not wear them. Resume normal activities within the first 24 hours, and no strenuous activity for 1 week, like running or gym or spinning. Very severe exercises can actually cause the vein to be more inflamed. Next slide. And the follow-up, you don't actually need multiple follow-ups for your patient, just probably 1 or 2, and then you can discharge them. And I used to follow them up quite regularly for research purposes when I was at Singapore General, but that is not necessary clinically. And we use an ultrasound to make sure the vein has been closed by the keyhole method. And then we will, basically, if that's the case, it normally stays shut. Next slide. So this is the new kind of device that we're using. You see how small the device is. It fits in via sheath. It's called microwave. And that's what we do. We heat the vein, very similar to radiofrequency ablation, and then basically go all the way to the groin. Next slide. Inside, basically, the temperature is heated to about 85 degrees. Radio frequency is about 120 degrees, and laser can go over to 1,000. So you can see the temperature differential between the three types of devices, and that is why you get less pain with microwave. Next slide. And which are the veins that we treat? Those big veins with those big legs, you can see those are the ones to choose. Next slide. And all you do is you pass the catheter again using ultrasound, and you heat the vein pulling backwards. Next slide. And you can see positioning, how we position the vein based on ultrasound. You can see the tip of the you can see the tip of the probe on the right-hand picture is just below the deep vein, and then you basically pull back and block the vein. It's very straightforward, very quick, and patients are on their feet immediately. Next slide. And we use a special protocol that we've developed over the years to burn the vein and keep it shut. Next slide. And you can see all you're left with is a little puncture that doesn't even need a stitch. And you can see the minimal bruising afterwards, and a bit of swelling around the leg, and that is why you use a compression dressing for 48 hours. Next slide. And then we pull out the little side branches using hooks. This can all be done under sedation and local anesthetic. You don't need a full body general anesthetic for this procedure. And in fact, if you do sedation and local anesthetic, they recover much quicker. Next slide. And you can see the effect. This is 1 week after microwave. You can see the image on the right-hand side. The vein is being blocked very successfully on the inside of the thigh and proximal calf. And you can see there's minimal bruising to the thigh and the leg. Next slide. This is another 1 week on a thinner leg. And again, you can see the vein is blocked successfully, but there's minimal bruising and discomfort on the thigh. And the pain scores are like 0 or 1 out of 10. If 10 is the worst, like giving birth, this is like 0 or 1 out of 10. Next slide. In fact, the bruising is more actually by pulling out the side branches compared to doing the microwave ablation. Next slide. So the initial experience that we had when we set up during COVID, you get less post-operative pain with this procedure, less bruising, and less swelling. And patients tend to not to use compression, which is a big added advantage. Also reduces the cost by a couple of hundred Sing. And even with the bigger veins, you can actually do a very good job. Next slide. Even for ulcers, you can take it all the way down to block the vein, the culprit vein that's causing the ulcer to not heal, and you don't get any nerve injury below the knee. Next slide. And the pain scores, this is a 50-patient cohort followed over a 2-week process. The pain scores are very low. They're like 0 to 1, the median scores out of 10. Next slide. And they return to normality very quickly. Nearly 45% resume daily activities on the day of the procedure, right? And then basically, a lot of these don't go back to work because they like to have an excuse for an MC, all right? But you can see at day 10, almost they're doing their normal daily activities. So recovery is very fast. You do not need to be in bed. Next slide. And this is the patient satisfaction questionnaire that we often use in research and venous research. You can see a lot of these patients are very satisfied and will have the procedure again. Next slide. So these are the non-thermal. So when would you use non-thermal as opposed to thermal, like microwave and radio frequency ablation? Well, I would use these for veins below the knee because the nerves are much closer and therefore you don't want to risk any damage from heat. And actually, a lot of the ladies like to use these less invasive devices because they've got less needle sticks, and everything theoretically can be done through one little pinprick without a suture. Next slide. So what are the potential benefits? You get no need to use heat. no risk of thermal injury, no nerve damage. You don't need tumescence, which means that you don't need any local anesthetic around the vein for the thermal ablation types. No multiple visit. You can actually deal with multiple veins at the same sitting, treat multiple veins at the same sitting, and a very quick return to normality. And it is shown to be safe and effective. Next slide. Clarivane, this is a young female's delight. This is even smaller than things like glue. And this vein spins inside to the vein, and we use special sclerosant to block the vein as we pull out. Next slide. And the mechanism of action of this device is we spin inside the vein, block the vein, cause vasospasm, and we inject a special chemical to block the vein. And can be done without any anesthetic, local anesthetic if possible, just to puncture the vein, which is the most painful bit, and it can be done in the office setting. Next slide. And all you see is this white stuff, the sclerothrombus within the vein, and that's it. And that's what you see on ultrasound. Next slide. And this is what you can get from this kind of results, the pre-treatment and post-treatment at 2 months. Next slide. Very useful for ulcers below the knee and around the ankle. You can get rid of those veins and that wound will heal very quick. So if you see a wound that's not healing within 2 weeks, think either you got no blood getting there or the blood is not getting out of the leg because of vein problems. Next slide. Glue. This has become very popular from the US, and I was one of the first to use this in Singapore in 2016. I've done over 500 cases. I've just done one this morning, and basically the patient can go home the same day. No sutures, no wounds, and they don't even need compression. Next slide. And that's what you do. You pass the catheter up where the reflux is causing the problem, and then you just pull out, and you don't even need a stitch at the end. Next slide. And we've also done, if you put my name in the PubMed or into the research, basically we've got very good experience using glue in Asian patients from Singapore. Next slide. Whether you compare the MOCA, the Clarivane, against the glue, actually they're both exactly the same. And when we would use one over the other, it depends whether you want a foreign body inside that vein or not. Next slide. You don't need compression after using these devices, which is a big added advantage in our patient population. Next slide. Sclerotherapy, we use a lot of this to deal with the smaller veins, the reticular veins or thread veins for cosmesis, and we give that full package. It's less effective because recurrence is highly higher, so we don't tend to use it for the main truncal vein, but we do use it for a lot of the side branches. Next slide. And what basically the adverse reactions are really minimal, but you can get some staining of the skin, visual disturbances if you use too much. Also, you cannot go into the sunlight for a couple of weeks, otherwise you risk pigmentation of the skin. Next slide. And this is kind of the sclerosants that we use, and we have a full array of them, and we use different concentrations for different indications. Next slide. And we mix it. This is with the old Tesari method of creating foam, which is more unstable. Next slide. And that's what we do. Just inject it with a very small needle on the ultrasound guidance into the side branches. Next slide. And this is some of the new advances. So this is a recent case whereby we've been doing really small, fine veins. And you can see Dr. Wong and I have got a team effort going. Basically, one injects and we're one very still. We're using a 27 gauge needle into really small veins. We're using loops. And you can see Dr. Wong is mixing up the foam in this new device that's come from the US called the Varises machine, which creates very stable foam and is thought to reduce the risk of recurrence. Next slide. So with varicose veins, you've got a personalized kind of journey. You have to treat the patient, but also treat the veins that they have and treat the underlying anatomy. So to just choose one device would be what I would say regressive. you need to be progressive in terms of thinking what is best for that patient at that particular time. Next slide. And this is the new thing that we're offering at the Vascular and Endovascular Clinic. And no one has yet done this in private, but this is true scarless surgery, whereby you can blast the vein and block the vein from the outside without a single incision made. And what that means is that you're not introducing anything into the vein, and the risk of it going to the lung or traveling anywhere in the vascular circulation. Everything is done from the outside. It's almost like Space Invaders, where you're hitting the vein using what we call high intensity frequency ultrasound. Next slide. And you can see what happens is that basically these rays go up and down, and you concentrate it on the vein, which you can see with the arrow, and it basically clots off. Next slide. And this is really less painful than an incision. And you can see some really good results. Healing of ulcers is very good for, but it is expensive. And it's really for those fee-paying patients at the moment. Next slide. Next slide. Now, this is the complete package that we're offering at the Vascular Endovascular Clinic, and no other vascular clinic will offer this in Singapore. Not only do we treat the underlying truncal veins, but we also treat the cosmetic thread veins or the spider veins that come up on the surface for young women or for those who are cosmetically upset. And we have this new laser that we've bought. And we also have the brown pigmentation. We can use a Q-switch laser to try and lighten it for them. Next slide. And this is what are some of the results that we've had. This is an example someone has had. You can see these spider veins before, and with 2 treatments, you can see it's gone. Next slide. So my take-home messages for varicose veins. It may not seem as glamorous as aortic disease saving people's lives, but actually is much more common, and you can make a big difference almost immediately. Everything almost is done keyhole now. Nothing much is done as an open surgery. Return to normality is much quicker, minimal downtime. We have all the devices at our disposal, and we normally use the best device tailored to the individual patient. So if you have a patient with potential venous disease, ask Livinwell to actually ask us to see the patient. We document the history, and then we move on. And then we get them an ultrasound, which we can easily do the same day they see us and actually treat them. And I've treated a patient even the same evening because they wanted to fly back to Indonesia. So it can be done very quickly, and the insurance should not be an issue for medical grounds. Next slide. And in that, I thank you very much for listening. I'll be delighted to take questions along with Dr. Wong.
Sorry, your side, no.
I don't know what's better.
So if they want to take questions, I'll come in. That's all. Because
We both hope that it's been helpful for all of you guys listening, and
Yes.
and I'd be delighted to take questions for both the aortic segments and also the varicose veins. Do you want to come sit here, Gina?
Okay, so thank you so much, Dr. Julian and Dr. Tang, actually. So we will start in our question and answer section, right, Risha?
Okay, the first question is from Dwika, ya, from Mojokerto, Indonesia. Pertanyaan dari Ibu Dwika, Mojokerto, bagaimana pencegahan agar tidak terjadi varises, ya, seperti yang sudah dibahas oleh Dr. Tang. How to prevent varicose veins from occurring, Dr. Tang.
Sorry, Dr. Tang, you are mute. You are mute.
you can actually speak on that. I don't know how to.
I think, Doctor, if possible, Dr. Tang and Dr. Julian can sit together. It's fine.
Yeah. No problem.
Yeah,
So
fine.
basically, how to prevent it? You can't prevent it, unfortunately. It's a progressive problem. So basically, if you're likely to get it, you will get it. However, you can try exercises, avoid a sedentary lifestyle. If you've got a desk job, get up and about, walk for half an hour, move around, all right? Squats are very good exercises to develop the muscles in your calf. Swimming, walking in high water to improve the hydrostatic pressure is also very useful. The fact is, losing weight, great way to put less pressure on your legs. Keeping a dose of vitamin C, zinc, all of these are very good for vein health. Don't smoke. Smoking is very bad for the vein valves. Bit of salmon, bit of vitamin D. Those are the kind of things that people tend to do to try and improve things. But really, the only medication that's been shown to work is Daflon, which is like concentrated orange peel.
Oke, so Pak Risha, kira-kira saya akan translate sedikit ya. Menurut Dokter Tang, bahwasannya varikose itu tidak bisa dihindari ya. Sebenarnya yang penting itu dari kita itu harus bisa menjaga pola hidup kita. Salah satunya tidak boleh merokok, harus berenang, menjaga tingkat zinc kita, dan semua itu adalah sebenarnya diterapkan dari pola hidup. Jadi tidak ada sesuatu yang spesifik dari medis yang menyebabkan varikose ini. Kira-kira begitu, Mbak Risha.
Oke, jadi ada hubungan relevannya dengan pembahasan topik kita kali ini, yaitu penyakit pembuluh darah ya, Miss Marlin ya. Penyakit pembuluh darah seperti tadi yang sudah dibahas Dr. Wong, yaitu penyakit atau kelainan aorta. Kemudian tadi juga Dr. Tang juga membahas tentang varises, dan seperti yang kita bahas sekarang, ada kelenjar getah bening juga merupakan salah satu dari kelainan pembuluh darah ya, atau penyakit pembuluh darah, dan kita akan membahas satu persatu di sini. Pertanyaan selanjutnya, Dr. Tang dan Dr. Wong dan juga Miss Marlin. Pertanyaan dari Silva Okta dari Kota Aceh. Apakah ibu hamil yang terkena kelenjar getah bening akan berdampak juga pada bayinya? Dan seberapa parah dampak kepada bayinya dan perkembangan dia ke depannya? Jadi this questions from Miss Silva Okta from Aceh, Indonesia. Will pregnant woman with lymph nodes also have...
Sebentar, Mbak Risha. Mungkin dokter lagi ada ini. Yes, can you hear us, Dr. Tang and Dr. Julian?
Yes, we can both. Yep, keep going.
Yes. So, yes,
okay.
We have a next question. Risha, please.
Yeah. Okay, the question is from Silva Okta from Aceh. Will pregnant woman with lymph nodes also have an impact to their babies? And how severe is the impact on her baby and her future development, doctor?
It all depends. Sorry. Depend on where your lymph gland is. Obviously, if your lymph gland is from the thyroid gland, it may affect the pregnancy. As you know, the thyroid controls the metabolism, and it will also control the metabolism of the baby. If you have just an oral mouth infection, you can take care of it with antibiotics and the lymph gland will settle down. Obviously, if you have other disease, like lymphoma and other things, of course, it will affect the baby, because if the lymph node turn out to be cancer, and you need to undergo chemotherapy, I mean, the pregnancy will be very threatened, Yeah.
Jadi begini ya Mbak Resya ya, ada jawaban dari Dr. Julian, saya sedikit keras lagi. Jadi itu sangat berpengaruh untuk perkembangan bayi atau janin dari sang pasien ya. Jadi tergantung lagi apakah limfoma ini berbahaya atau dalam arti cuma sekedar infeksi atau memang sudah infeksi begitu ya. Jadi tergantung ya. Dan kalau memang sudah infeksi dalam arti memang sudah terdiagnosa limfoma ini, itu akan sangat berbahaya untuk sang janin bayi. Begitu, Pak Risha.
Jadi apabila sudah mencakup ke stadium kanker, akan melakukan kemoterapi seperti itu ya,
Iya, benar.
Baik, pertanyaan selanjutnya, next question. Pertanyaan dari Abdul Salam dari Indramayu, Jawa Tengah. Selain operasi, apakah bisa dilakukan pencegahan terhadap penyumbatan pembuluh darah atau alternatifnya? Okay, the question is, in addition to surgery, can there be preventive or of blockage of blood vessels? What is the alternative, doctor?
I think it's a good healthy lifestyle. Blockage of blood vessels normally involve people who have a lot of smoking, high cholesterol, and high blood pressure, and as well as most commonly diabetes. So if you live a normal lifestyle, you're not diabetic, you don't smoke, and you check your regular blood pressure from your GP, and you exercise well, the chances of you having a blocked vessel is very little. However, if you already started smoking for some years, I would ask you to go to your own doctor to get your blood vessels taken. The simplest assessment for any problem with blood vessels is to do an ankle brachial pressure. You can roughly, the value will tell you whether there is or is not a minimal narrowing or blockage of your artery. Okay?
Jadi Mbak Recha sedikit mengenai penjelasan Dr. Julian, bahwasannya itu semua itu tergantung dari gaya hidup sang pasien ya, atau kita sebagai personal ya. Jadi semua itu sebenarnya bisa dihindari ketika kita pola hidupnya sehat, berolahraga, dan tidak merokok. Karena merokok itu yang paling besar padahal menyebabkan pemblokiran pembuluh darah ya sebenarnya Mbak Risha ya. Jadi diharapkan kalau misalnya kita ada yang banyak merokok atau pola hidupnya tidak sehat, segeralah lihat ke GP kita. Namun kalau memang sudah terdiagnosis, akan melakukan segelintir tes ya. Seperti tadi angio, sorry Dr. Julian, angio. Dr. Julian, which procedure just now? Angio?
Angioplasty.
You will do to the angioplasty, ya. Jadi
what's your question?
No, I was just repeating the angioplasty procedure just now for the patient who wants to check on the blockage on the veins.
So I think if you have a blockage, depend on how bad the blockage is. If it's just a small narrowing and it doesn't affect you from walking, sometimes you can just take tablets. When you have a blockage and you have pain on walking and quite severe, even pain at rest, or any kind of tissue loss or ulceration, then the balloon angioplasty needs to be done, because when you do balloon, you can open up the artery and improve the blood supply to the various area. That will take away your pain, as well have to improve the oxygen to the tissue, then the tissue can heal. And for those people who cannot walk, angioplasty may help. I mean, gone are the days that we need to do bypasses. I now do less than one bypass a year. Majority of them is myself and Dr. Tang. We work together to do all the difficult angioplasty wherever it may be in the lower limb. I mean, the success rate are very, very high.
Oke, jadi Mbak Resya, seperti yang Dr. Julian bilang ya, sebenarnya berarti penyumbatan pembuluh darah ini ada dua macam ya. Kalau selama masih yang light, dalam arti tidak berat, penyumbatan ini bisa disembuhkan dengan cara memakan obat. Namun jika sudah sangat parah, dalam arti sudah memang penyempitannya itu sangat besar, maka hal ini akan dilakukan angioplasti, yaitu adalah suatu prosedur yang di mana dokter harus melakukan pembesaran pembuluh darah dengan memasukkan sejenis balon, seperti itu Mbak Resya. Jadi tergantung ya akan tiap-tiap pasien, jika bisa terdiagnosanya itu harus dicek terlebih dahulu oleh Dr. Julian dan Dr. Tang.
Oke, jadi untuk pertanyaan tadi Pak Abdul Salam, jadi cara alternatif selain operasi itu bisa dengan meminum obat, jadi tergantung juga seberapa tinggi level pemblokan atau penyumbatan darah yang Anda alami, seperti itu ya Pak Abdul Salam. Baik, kita ke pertanyaan selanjutnya. Pertanyaan selanjutnya adalah dari Pak Handi Yan, ya. Apakah jika sudah prosedur varises bisa kembali ke awal nadinya atau apakah tidak bengkak? The next question is from Mr. Fandi Yang. Can varicose veins return to their original state before swelling, Dr. Tang?
So varicose veins means that it is abnormal. Once you develop varicose veins, it can never go back to normality because the valves that keep the blood running in one direction from the foot back up to the heart have already become faulty and the whole vein is dilated up. So whatever you do, you're not going to be able to get that back to normal. It's only progressive. And once you have symptoms, you need to do something about it. So no, answer is no.
Oke, jadi tidak bisa ya, Mbak Resya ya. Jadi hanya bisa memperbaiki mungkin sistemnya saja, tapi untuk kembali ke awal mungkin tidak bisa.
Oke, baik. Jadi untuk Pak Hendian itu tidak bisa kembali normal ya, tetap pasti apabila sudah melakukan prosedur tidak akan kembali normal seperti sebelumnya. Baik, pertanyaan selanjutnya. Ini tidak ada nama dari pengguna Zoom ya. Mengapa bisa terjadi penyumbatan pembuluh darah? Oke, ini the question is for Dr. Wong, maybe yeah, this question. Why can blood vessel blockage occur?
Sorry, come again. Why does blood vessel blockage occur?
Yeah.
Okay, the process is called arteriosclerosis. And normally, you have to have some insulting factors, most likely high blood pressure to start off with, or smoking. So the vessel wall, the inner lining of the blood vessel is damaged. And when it's damaged, first of all, the body will try to repair it. When the body try to repair it, they will deposit fat deposit and scar tissue inside the artery. So when they repair, the artery will start narrowing. If this process carry on through smoking, high blood pressure, then the artery will carry on narrow and narrow. The smoking has a direct chemical effect to damage the artery. And the high blood pressure is pure physical force that actually damage the sidewall of the artery and cuts into the sidewall. So that's how the artery try to repair itself. Now, if you have high cholesterol, the cholesterol deposits will develop in the narrowing areas. And diabetes actually works in a slightly different mechanism, whereas diabetes actually block the smaller blood vessels, not the larger blood vessel. Okay?
Jadi seperti yang tadi disebutkan ya Mbak Resya, sebenarnya banyak sekali ya yang menyebabkan penyumbatan pembuluh darah ini. Salah satunya tadi seperti kita bilang ada dari merokok, juga ada sebenarnya dari jaringan tubuh kita sendiri. Namun tubuh kita ini adalah suatu ada jaringan tisu yang bisa memperbaiki penyumbatan pembuluh darah ini. Namun kembali lagi tergantung dari bagaimana habit kita. Seperti tadi dokter bilang ada juga dari diabetes, ada juga dari kolesterol, dan hal-hal seperti inilah yang menyebabkan penyumbatan pembuluh darah kita, Mbak Risha.
Oke, jadi itu tadi jawabannya untuk pengguna Zoom tadi ya. Oke, pertanyaan selanjutnya ini saya ada banyak banget nih pertanyaan ya, Miss Merlin. Jadi saya akan memilih yang terbaik karena waktu kita juga terbatas. Ini pertanyaan dari Ibu Cut Putri dari Tangerang. Apakah orang atau anak yang sudah melakukan operasi kelenjar getah bening akan menurunkan tingkat imunitas orang tersebut? Jika iya, bagaimana untuk menanganinya? This is the question for Dr. Wong. Will people or children who have a lymph node surgery reduce the person immunity level? If so, how to deal with it, doctor?
Actually, when you have lymph node surgery, it doesn't reduce because we're only doing one lymph node. You have many lymph nodes in the neck to protect you. Taking one of the many lymph nodes will not change your immunity. What change your immunity, is if you take a lot of lymph nodes, but you will get what we call lymphedema. The classical picture is when you take a lot of lymph glands from the armpits when people do mastectomy, and they take the lymph node away, then actually it's a drainage problem rather than an infection problem because you got so many lymph nodes in your body to protect you, so nothing to worry about.
Jadi Mbak Resya sebenarnya limfoma ini adalah sebenarnya sebagai suatu hal yang dimana penumpukan cairan karena adanya penyumbatan, dan limfoma ini bisa jadi kembali lagi ya Mbak Risha ya, hal-hal seperti ini tiap orang punya diagnosis yang berbeda, jadi untuk menjelaskan lebih medisnya harus kepada dokter lebih lanjut, Mbak Risha.
Oke, jadi untuk hal-hal yang seperti ini kita harus mendiskusikan langsung kepada dokter langsung ya, dokter ahli seperti Dr. Wong ataupun Dr. Tang. Baik, pertanyaan terakhir, Ms. Merlin. The last question. Pertanyaan dari Ibu Yelnia T. Triyanti dari Padang, ya. Berdasarkan indikasi varises terjadi kebanyakan pada wanita dan 40%-nya orang dewasa. Bagaimana jenis kelamin dapat serta umur bisa menyebabkan terjadinya varises? Apakah anak-anak bisa berdampak terjadinya varises? Lalu apa penyebabnya varises pada anak-anak? Nah, the question is for Dr. Tang.
Yeah,
Based
go
on
ahead.
indications, varicose veins occur mostly in women and 40% of adults. How can gender and age cause varicose veins, doctor? And can children have an impact on varicose veins? And what causes varicose veins in children?
So that's a great question. So does age and does sex or gender, or I think actually having a predisposition? Well, yes, age, because we think this is more of a degenerative problem. Gravity is never your friend. It's pulling the blood down. It's pulling you down as you stand up or sit down with your legs down. So basically that is causing part of the problem. In terms of sex, in terms of male or female, there isn't a predilection to one side or the other. Actually, both are similarly affected. We know that genetically there is a hereditary disposition, but the data yet is not very clear on which genes they are and which people are going to affect. In terms of children, I've actually treated a head nurse's son from one of the public institutions from Singapore when I was at Singapore General as young as 14 years old. However, you've got to think whether there's an underlying connective tissue disorder or even some sort of malformation in the leg if you're going to be quite young and present like this. And normally it's part of a syndrome like Klippel-Trenaunay syndrome. And even then, in those situations, you try not to treat the veins when they're so young.
Jadi Mbak Resya, sebenarnya ini semua tergantung juga ya Mbak Resya ya. Ada juga yang kalau ditanya tadi Mbak Resya, menurut umur, gender, ataupun usia, sebenarnya semua itu ada juga sedikit faktor genetik, namun kebanyakan itu adalah faktor dari luar sendiri Mbak Resya. Ya Mbak Resya.
Ya, jadi faktor dari luar sendiri dan seperti yang kita tahu, bumi memiliki gravitasi, jadi Jadi untuk saluran darah pasti selalu ke bawah ya, Miss Merlin ya. Jadi pasti akan berdampak mau usia berapa, mau gendernya apa, pria, wanita, anak-anak bisa berdampak pada penyakit varises ini. Seperti itu ya, Miss Merlin. Baik, yang terakhir nih, saya mau minta tips dan trik apa yang harus kita lakukan untuk pencegahan penyakit seperti kelenjar getah bening, varises, dan juga tadi seperti yang kita bahas aorta ya, masalah pembuluh darah. Dr. Tang and Dr. Wong, what is the tips? What we have to do to prevent these diseases, the vascular disease? Like varicose vein and aorta disease, what is the tips for you, Dr. Wong and Dr. Tang?
So let me start first, and I'll hand over to Dr. Wong. So in terms of venous diseases, so the venous side of the circulation, unfortunately, you can't really prevent that. All right, it's going to happen as you get older. But someone who's sedentary, who's sitting down all the time, is not going to be someone who's going to be lasting too long in terms of dealing with the problem. You need to have exercise, being on the move all the time, moving your joints, be more flexible because you're going to be all stiff later on as we get middle-aged. Good diet, have some of the basic vitamins like magnesium, like zinc, like vitamin C, some oily fish. All of these are very important for basically for vein health. And no smoking. Julian, I'll ask you to talk about the arterial side, basically.
Okay.
How to prevent all this.
Well, arterial side is even more simple, similar to the vein side. When you want to lead a healthy lifestyle, smoking should not be done. You should go to your GP to check your blood pressure regularly. You know, you should eat healthily so that you don't get yourself into diabetes. Keep your blood pressure low. Exercise is always good. I mean, I think the two important take-home message for preventing any vascular disease is exercise, you know, and no smoking. And then I think the rest, eat healthily, and everything in moderation. That's all I can say. Thank you.
Oke, Miss Marlin.
Jadi kesimpulannya yang Mbak Resya dari Dokter Julian dan Dokter Wong, jadi yang penting itu sebenarnya kita itu kalau bisa menjaga kesehatan badan kita dengan satu cara berolahraga yang banyak, kedua juga jangan jangan merokok ya kalau bisa ya, bukan jangan banyak merokok, jangan merokok. Ketiga kita juga kalau bisa itu harus memenuhi vitamin di dalam tubuh kita sendiri. Karena penyakit varises, penyakit pembuluh darah ini tidak bisa dihindari seiring usia, itu memang akan terjadi. Namun mungkin yang bisa kita lakukan adalah menjaga. Itu saja Mbak Resya dari Dr. Julian dan Dr. Wong.
Baik.
Thank you.
Thank you for your time on this webinar. We really appreciate it, Dr. Wong and Dr. Tang. Hope to
Thank
see
you very
you
much.
at our
Very
next.
nice to meet you guys. I want to
Yeah,
thank
webinar.
Livinwell. I want to thank Livinwell for basically giving us this opportunity. I think they're a great platform for communication between the Vascular and Endovascular Clinic and with you guys. And if you need any kind of advice or any help, please drop us a line. Very happy to help. From our website, you can get a lot of important information on both vascular and keyhole methods of treatment of vascular disease. So we look forward to seeing you again, and please keep in touch.
Take care.
Oke, thank you. Jadi untuk berkonsultasi dengan Dr. Tang dan juga Dr. Wong, Anda bisa menghubungi Livinwell-Shinon dengan melampirkan identitas seperti KTP ataupun paspor dan juga resume medis Anda. Jadi Livinwell-Shinon akan menghubungkan Anda dengan Dr. Tang dan juga Dr. Wong, ahli bedah vaskular dan bedah umum dari Singapura, The Vascular and Endovascular Clinic, agar kamu mendapatkan perawatan yang tepat. Thank you juga buat Miss Marlin yang telah bersama kita membahas mengenai topik pembahasan kita kali ini, yaitu tentang penyakit pembuluh darah. Baik, sekian webinar kita kali ini. Kami berharap webinar ini dapat menambah pengetahuan dan wawasan Anda. Jangan lupa follow sosial media Livinwell-Shinon untuk selalu update webinar gratis dan info menarik lainnya mengenai kesehatan dan pengobatan suatu penyakit. Untuk informasi lebih lanjut, Anda bisa menghubungi melalui WhatsApp di 0817 289 911, 0817 289 911. Dan untuk mendapatkan e-sertifikat dari Livinwell-Shinon, Anda harus follow sosial media Facebook Livinwell-Shinon dan Instagram Livinwell-Care. Cek Instagramnya dan pastikan Anda sudah follow untuk mendapatkan sertifikat webinar kita kali ini. Baik, sekian dan terima kasih. Sampai jumpa di webinar selanjutnya. Bye.
Thank you so much.
Bye-bye.
Thank you so much, Mbak Resya. Thank you so much, Dr. Julian, and thank you so much, Dr. Tang.
Thank you.